Goes. Let's see how this goes, shall we? Let's take a look. Let's see how this goes. Let's see if we can find it, and let's see if it works. I don't know. Maybe it will. Maybe it won't. I don't know. Let's see. Let's just see. Let's just see, obviously. Maybe it'll work. Maybe it won't. That's the beauty of this thing. All right, I think we're up and running on YouTube. Everything looks good. Let's just get this shared on ye old Twitter, and then we will be off to the races as we always are on Saturdays. So just one moment, uno momento, as they say in Spanish, and we'll get going. Okay, just going to send this tweet out and then we'll be good to go. Sorry for the delay. Okay. So we're shared. Our live link is shared on Twitter, and I think we are ready to go. It's shared. All right, we're ready to go. Good afternoon, everyone. Good morning, good evening, whoever you are, wherever you are. It's awesome to be here. Thank you all for showing up, watching, listening, commenting, so on and so forth. My name is Dr. Patrick Lockwood, and this is UnShrink Me. For the purpose of this podcast, I'm just Patrick, so don't sue me or anything. This is a weekly podcast. If you are brand new to UnShrink Me, the goal of this podcast is very straightforward. As a clinical psychologist and a professor and a consultant and all the things that I do, what I have noticed is that there are lots of people who are misinformed, underinformed about what therapy is, clinical psychology, psychiatry can and cannot do. And so the spirit of this podcast is very simple. Let's create a more informed consumer base about topics related to mental health. Because I believe the more empowered and the more informed everyone who is seeking out therapy is, or are, I don't know. End of the semester, my brain's fried. So the more informed and the more empowered people are, the more likely they are to get the best result from their services. So I want everyone who's watching and listening, whether you're a professional in the field or you're a patient or a loved one of a patient, my main goal is, can you have some new perspective, some more helpful perspective for what you're going through, for the services you're seeking out, from the medications you're taking, etc., so that you get the most possible benefit. My goal is to be critical publicly, to be publicly skeptical as someone inside the profession, and talk about ideas in a way that is helpful for the people consuming services. That's my only goal. I have no other goal. I'm not here to become super contrarian. I'm not here to be anybody but myself. And so my only goal is to talk about current events with regard to mental health, psychiatry, clinical psychology, etc., so that you, the consumer, can get the most out of your therapist, counselor, case manager, coach, psychiatrist, whatever you're doing to improve your life. So that's the spirit of the UnShrink Me podcast. Thank you for watching and listening. Thank you all for being here. We have some interesting topics today. We're going to talk about depth psychology and depth psychotherapy because that's a trendy topic online, but also in real life. You got to get deep to solve your problems. We're also going to talk, I think, somewhat at length, maybe not, I don't know. We're going to talk about what it means to take personal responsibility and why that matters. And I think the other thing that's really worth talking about, which I think might take up the larger chunk of our time, is this idea that the patient is the expert in their own lives. So really, that one I think will be a fun one because I think it's a really complicated one. And I think it'll be good for the patients who listen, the family members of patients, and also some professionals who are listening, because I think a lot of people have mistaken impressions about what that hokey phrase actually means. So we're going to talk about those three things. I don't even know if we'll get to all three of them, but we'll see. And as always, this podcast is not NOT, so don't sue me. This podcast is not sponsored by Celsius. However, I love this stuff, and it's great. It's good stuff. I have a Celsius pretty much every day, basically, and so I guess I'm addicted. I don't know. That is good stuff. All right. Hoorah, Phil. Glad you're here. Good to see you. So, first thing on today's podcast, I want to talk about depth psychology. I want to talk about what it means to get deep in therapy. So, many of you will probably understand, both personally and if you ever listened to podcasters and therapists and Jordan Peterson and all these famous people, they talk about, dealing with the deep problems in life. And off the cuff, I don't have a super big problem with that. I think for many folks, there are, let's call them deeper parts to their sense of self or their early childhood stuff that they haven't fully grasped. And because they haven't grasped these early in life injuries, experiences, whatever, they have a harder time relating to people in a way that's optimal for their needs. So from that perspective, I'm totally okay with so-called deep therapy. I think so-called deep therapy is perfectly useful for people who are really pathologically relating to other people. So a good example of that might be people with certain types of personality differences, personality disorders, people with very, very severe early childhood trauma, etc. So there's a lot of stuff that might cause a human being to be an adult of whatever age, but to have some earlier in life injuries or organizational differences, personality differences that are quote unquote deeper. And so deep in this context, deep in the context of therapy typically means one of two things in my experience when I hear people talk. So-called deep therapy is about looking at stuff that happened earlier in your life. So deep is kind of a metaphor that's like a lame excuse to talk about what happened when you were earlier in life. You could just say, I want to talk about your early childhood stuff, and that's completely the same thing in most people's cases. However, there's another way in which therapists, especially psychodynamic folks and psychoanalytic folks, talk about so-called deep therapy. And what they really mean by that is something that is buried, right? So there's this idea, essentially, that human beings are often unconscious creatures in the sense that most of us, whether we're super smart or not, or super insightful or not, there's still a large chunk of our inner life, our mental life, that is secret to us in the sense that we are mostly unconscious creatures. Most of what we do, say, think, and feel is not motivated by some conscious thought process. That's a myth. It's the idea that our conscious thought process is like a PR company. Our brain kind of like gives us conscious thoughts that we can see and hold on to because that's what's palatable, right? That's what we can tolerate. But in reality, the deeper stuff, the stuff that's hidden in our unconscious or preconscious awareness, if you want to be technical about it, is the stuff that really drives our behavior, our motivations, our thoughts, and our feelings. And so this idea that there's a deeper version of you in the sense that there are thoughts, feelings, and motivations that are quote unquote hidden underneath conscious, readily observable in your mind experiences. So if my conscious thought is, I'm a bad person, what's the deeper thing underneath that, right? So there might be some deeper like feelings that are literally hidden, like in the ground, like hidden, that you can't readily see. Just like if, there's a flower above the grass that you can readily see, but underneath that's a dead cat, underneath that's a dead person, 6 feet down, and underneath that's, oil or whatever. But like deep where the oil is in the ground, I don't know how that metaphor worked, but it worked. Generally speaking, that deeper thing, that oil, that you want to strike oil, metaphorically if you're a therapist, that deep thing is where like the richness is, the resources are, which, in psychoanalytic thought makes perfect sense because the psychoanalysts believe, somewhat rightfully, that human beings are mostly unconscious creatures. And so-called depth-oriented psychology, psychotherapy in particular, is focused on the things that are not readily conscious in your mind, right? So I hope that makes sense to everyone. Excuse me. So depth-oriented therapy is about getting at the things that aren't readily conscious, just so we're clear. We're looking at the things that may or may not be super obvious or not obvious. So for instance, all of us have defense mechanisms. All of us are super interested in some degree of, social cohesion, looking good, feeling good, getting along with people, being valued in the world, all these things. And so we will defend against urges and impulses. We will literally be in denial about an urge towards aggression or an urge towards something sexual or an urge towards whatever that is not socially tenable, and it'll come out sideways in some way. And so that is where so-called depth-oriented therapy may be helpful, because if you're interacting with people in a very problematic way in your life, you might have some quote-unquote deeper things that are coming out sideways. Now, sometimes it's not super deep. So with all of that I just said in mind, I'm going to retweet something real quick that I believe is I think super important for this experience. And so my buddy Nick Tabor online is I think a really good catalyst for some of these conversations, because he just says provocative things that are worth exploring and expanding. Okie dokie. So earlier today, here's what Nick posted. I'm going to read what Nick posted, and then I'm going to try and explain what I think is valuable and on track and not on track. So here's what he said, and here's the quote. In quotes, "Don't do deep introspection without a skilled mental health professional," in quotes, is a message people get all the time. As far as I can tell, what this ultimately means once internalized is that the truth that you understand of your life will be limited to what the mental health professional will allow, with all of their assumptions, biases, and ideologies. You'll be closed off from huge areas of awareness that might actually be necessary for substantial healing and growth. Okay, so there are dissertations packed into some of these tweets that Nick posts. So Nick, just want to say real quick, I'm very grateful for you, because there's like a happenstance, there's a God thing that happens where you just randomly post something that I think is super important for everyone to understand and unpack together. So thank you, Nick. So let's talk about the quote that you put in your tweet first. So the quote is, "Don't do deep introspection without a skilled mental health professional." So let's talk about that real quick before I get into any other piece of this tweet. So I want everyone to understand, first and foremost, that you can have deep and profound experiences outside of therapy every day if you want. You can have a deep and profound experience praying, if you're the kind of person who prays and has a relationship with God. You can have a deep and profound experience doing insane types of meditation and yoga if you want. You can have a deep and profound experience if you do psychedelics, for instance. You can have a deep and profound experience if you listen to the right song at the right time in the right emotional state. There's just so many deep and profound things that human beings can experience every day. And they don't always have to be of a life-changing nature. Deep and profound doesn't mean life-changing. There's a lot of depth in many of our everyday experiences, but most of us are too self-involved, ignorant, stupid, and emotional to actually notice this really cool stuff that's happening all day, every day. Most people are really lacking in gratitude, for instance. So, first and foremost, deep never, ever, ever has to be only in a certain context. Deep can happen in many different types of contexts: spiritual and religious therapy, psychedelics, yoga, meditation, prayer, all sorts of things. Nick Tabor's here. Good to see you, Nick. I hope you listen later, and just let me know what you think. I'd love to hear all of your comments, especially your skeptical, critical ones. So first and foremost, deep doesn't have anything to do with therapy in the first place. Deep has happened for thousands and thousands of years before therapy even existed. So That's the first thing. Second thing is the quote says, don't do deep introspection without a skilled mental health professional. So what I would argue is that the idea that a skilled mental health professional is going to help you see deep things is a bit of a red herring. Because as I've said many times in this podcast, most therapists are ordinary people. And because most therapists are ordinary people have an ordinary amount of insight, right? So most therapists are just regular people who have some special desire or interest or curiosity to help, but they're not necessarily super deep or insightful themselves. There's this old saying that you can only take people as far as you yourself have gone. So if you have a bunch of unresolved trauma or a bunch of unresolved shame or a bunch of unresolved resentment, guess what you can't help your patient with, right? And that's something I want everyone to know, is that not every therapist can really help you see deep things if that's what you're super into, right? A lot of people don't have any training to look at psychodynamic, psychoanalytic things, for instance. And although that training in and of itself doesn't make you very insightful, it can help you at least see some conceptual things and make you better at spotting quasi-deep things. So that's another point. A third point is that although certain professionals can help you see deep things, a lot of professionals that love depth are only loving depth because it makes them feel alive. So I'm going to say this as clearly and hopefully unevocatively as possible. So there are many therapists, especially psychoanalysts, who love to be profound because it makes them feel special and important. They love helping people see and hear and feel deep and profound things, understand their transference, understand their defense mechanisms and resistance, because the deeper and more profound it is, the more alive they feel as the analyst or the therapist. And so that's what we call narcissism. So they're doing something to make themselves feel awesome at the expense of the patient. And so I'm not saying all psychoanalysts do this or analysts do this all the time. However, there's I would say a relatively large subset of the profession who does so-called depth-oriented therapy who are just trying to get their own ego needs met, mostly at the expense of the patient. Now, maybe it helps the patient sometimes, but the truth is, a lot of people who talk about depth, especially on Twitter and on Instagram, they just are terrified of their own deep sense of self. And so their only safe ego defense way to deal with it is to deal with it in another person. They like to be voyeurs. So many therapists are maybe not sexual voyeurs, but they're emotional voyeurs. They get high or they get a sense of being alive from helping other people see deep and profound things. And that's kind of fun. Admittedly, I've done it with people as a professional, and it's a lot of fun because when you have a super profound insight, sometimes it really is life-changing, and that's awesome. That being said, that doesn't mean that searching for depth all the time in therapy will be useful, practical, healing, or whatever. So those are 3 thoughts about just that first quote. Sometimes it's a therapist narcissism. Sometimes therapists are just mediocre average people who can't really see that deep. And sometimes, you can just get depth and profundity in all sorts of things. In fact, I would generally recommend to all people of all cultures and all backgrounds that you find as much depth and meaning as is necessary to be a satisfied person across many domains of your life. In little things, but also in big things. In a giant ayahuasca ceremony or in hanging out with your friends or your spouse. I hope you have as much depth as possible and profundity as possible in big things and little things. That's my general hope. So let's go on with the rest of his tweet because he just nailed so many things. He said, as far as I can tell, what this ultimately means once internalized is that the truth that you understand of your life will be limited to what the mental health professional will allow, with all of their assumptions, their biases, and their ideologies. So this point of his is actually excellent, and this is something I try to help my interns with as a supervisor, as a clinical supervisor. So one of the greatest traps that every professional, every clinical professional, psychiatrist, psychologist, MFT, whatever, falls into is this idea that what you see matters, or what you think matters, or what you feel matters. And so let me just expand, because some of you might be a little upset by what I'm saying so far, but there's more to the story. So the undeniable truth is this. Therapists, mental health professionals that are trying to help you, guide you, do therapy with you, whatever you signed up for, they have their own internal life, their own thoughts, feelings, and some of them have to do with themselves as the therapist, and some of them have to do with you as the patient. And so the art of being a very good clinician is learning what's about you and what's about the patient. And then learning that difference is act number one. Act number two is having something skillful to do with what you're realizing. So if you realize that something you feel about the patient is about yourself, for instance, speaking of ideologies, biases, and assumptions, then what would you want to do that's the most ethical and logical and useful thing for the patient? So if you, the therapist, are having a reaction to the patient that's about you, not the patient, what should you do with that? Should you do nothing with it? Should you stuff it? Should you talk about it in supervision? Should you explore a thing that you think is happening? So should you use that feeling you're having to create a hypothesis and share that hypothesis with the patient and explore it together? There are actually many options. But what Nick is saying here is that one of the great dangers is when therapists, and this especially happens in private practices where there's no accountability, there's no peer support, you're not forced to talk to your colleagues. So you can just kind of do whatever and think whatever with zero accountability to the world. There's a lot of zero accountability therapists on the planet, and that's dangerous. And so the truth of the matter is that therapists have their assumptions, they have their biases, and they have their ideologies. And some of them are going to align with the patient's needs very well, and some of them will not. And then the question is, what safeguards do you have in place as the professional to make sure that your ideologies, your biases, and your assumptions are not harmful to the patient, right? Because no human being who practices psychiatry, psychology, therapy, whatever, is unbiased. No patient, no therapist, no matter how much they've meditated or how much therapy they've done themselves, is so neutral, is so objective, that they're not going to have bias slip into their clinical work, that they're not going to have ideology slip into their clinical work. It's impossible to be perfectly neutral, etc. So, what we want to be careful of is believing that the depth that your therapist wants you to experience is just about what you need, number one, but number two, about something that actually culturally, emotionally, psychologically, personality-wise is good for you, right? So that's a problem. And the third thing he says is you'll be closed off from huge areas of awareness that might actually be necessary for substantial healing and growth. So this is tricky because in some cases, for some patients with some types of disorders, sometimes huge areas of awareness can be discovered in individual therapy. Now, my buddy Jonathan, who may or may not be listening, would also argue, as I would definitely argue, that sometimes deep amounts of awareness, important dynamics that maybe you're not paying attention to, can only happen in the context of maybe a family therapy session or a couples therapy session. So for instance, if you're deep in the middle of a problematic family, a family that's very sick, which I've dealt with all the time in a rehabistan. Sometimes the parents of these young adults I have helped are sicker or as sick as their kid. And so pathological family systems where there's intense codependency or intense cutoff emotionally. These dynamics can't really be just seen in individual therapy. And sometimes they can, but most of the time it requires multiple people being involved in therapy at the same time. Now, in an ideal world, dear Nick, I would love it if parents were insightful enough to realize, Oh crap, the way I talk to my kid is really screwed up. Oh crap, my boundaries with my kid are really screwed up. And we should have a family conversation about how messed up our dynamics are. That would be beautiful. I sincerely wish that families of whatever generation, whatever culture could see how screwed up their dynamics were, but that's not a human expectation. Jonathan says, I'm here and I'm deadlifting. Well, good. I hope your deadlifting is going well in your garage, man. But the problem, Nick, is that sometimes family systems are so sick that a third party, a quasi-objective third party like a family therapist could be helpful, for instance. So I don't think it's black and white. Now, the phrase that you used at the end of your tweet, Nick, is substantial healing and growth. And so I want to talk about that real quick. So substantial healing and growth over what time period? So something I want everyone listening, especially if you're a family member of someone in therapy, or if you yourself are in therapy. I want you to think about this very carefully. And this is not one of those perfectly objective black and white things. This is a very gray experience I'm about to describe. People will naturally grow with time and experience. They really will. And sometimes people will naturally grow despite terrible circumstances. Sometimes people will naturally grow because of terrible circumstances like crappy parents or neglect or trauma. However, sometimes people will not grow because of those terrible circumstances or because of a lack of insight or because of personality pathology. So there's various reasons why people will or will not grow in a certain period of time. So what I will tell everyone is it's really hard to tell. Like as an academic, I cannot tell you over what time period people are supposed to change. As a professor, as Professor Lockwood, I cannot tell you that every patient with PTSD should achieve remission within 3 months. That's absolute bullshit. That's crap. That's a horseshit. And the reason that's horseshit is because every patient is different. Every patient has different culture, different spirituality, different personality organization, different strengths and different weaknesses. And so because of just those 6 things I just listed, it's impossible to know how quickly someone can heal from any particular illness. We can speak from the 30,000 foot perspective by just looking at the literature, but the literature is very, very biased. The clinical psych literature and the psychiatry literature is very biased because those are arbitrary guidelines. Those are arbitrary timelines. And they don't speak to the thousands or millions of people that do other types of therapy that are never included in the peer review process. So unfortunately for everyone listening, if someone tells you in 6 months you will feel X, that's a lie. It's a lie. It's literally a lie. It's malpractice. It's false advertising. And so the truth of the matter is, an ethical therapist can say we can expect to achieve certain types of outcomes together. However, it's not a rigid, cut and dried experience because sometimes in the course of therapy, you learn new things that will set back the pace of therapy or improve the pace of therapy. Sometimes good things will happen, and that will give you enough motivation and energy and relief that you can move along quicker. So there's so much variability in the speed of healing and growth that has nothing to do with depth and profundity, I would like to argue. I would argue that deep is a red herring that mostly suits the narcissistic needs of people who would like to feel special and feel powerful, such as therapists and psychiatrists and clinical psychologists and professors. That's what I believe happens most of the time when people talk about so-called depth psychology. These are people who feel out of control or helpless or not good enough or not smart enough, not safe enough. And that's okay. But then they've chosen to hide behind the cloak of professionalism and being a doctor or whatever it is to feel powerful, to have some sense of safety and distance and neutrality so that they can feel okay. So dear consumers of therapy, depth, to put it super simply after all this rambling, depth may or may not be helpful for you. Some people really don't need depth. Some people live perfectly ordinary lives, even with trauma or personality differences, And they can be perfectly happy and have plenty of meaning without doing super deep Jungian, Freudian, whatever bullshit to resolve their early childhood interjects and blah, 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 blah. That may or may not be helpful for people. Some people who just continually self-sabotage their life. And this is a rare subset of people, just to be clear. They've been to therapist after therapist, they've been to rehabs, and they continue to sabotage. And they've tried different types of therapy that don't really deal with the early childhood stuff or the early injuries or whatever. Things that are well defended against in psychoanalytic terms. And so they might benefit from depth therapy, and that will help them stop this self-defeating pattern of destroying romantic relationships or destroying business opportunities or destroying friendships or family or whatever it is. So there's an entire spectrum of difficulties that people can have that bring them to therapy. And I will be the first to say that depth-oriented psychology is fascinating and interesting, and the psychodynamics of people is fascinating, genuinely. So there's nothing pathological about being curious or intrigued by it. However, to apply it to everyone is silly. To believe that the vast majority of human suffering has to do with depth-oriented stuff is absolutely silly. It's narcissistic speculation on behalf of the people that believe that's true. It's really a spectrum. People are different. Every human being is literally different. And so the people that would benefit from quote-unquote more shallow therapies like CBT or whatever, that doesn't mean that their therapy is less important, just to be clear. And the people that badly need something more depth-oriented are not somehow special in a way that is like laudatory or morally better or something. So, Nick, let me say thank you for a little bit of grist for the mill. I had other things I was planning to talk about, but I felt very compelled to talk about this because I just know so many people that are literally up their own ass about how special and smart and deep they are when they're none of those things, and how much they care about helping patients find their deep problems. So thank you, Nick. That was a really important thing for us all to talk about. So depth-oriented therapy, sometimes helpful, but most importantly, you can have quote-unquote deep or profound experiences in everyday life if you're paying the right kind of attention. Now, it's hard to pay the right kind of attention, to like become like that Buddhist master who uses non-judgment and non-attachment and can have blissful experiences when you hug your loved one or whatever. Like, that's hard for the average person to do, but it is doable with or without psychedelics. So, let's move on to the next topic du jour for this podcast. I think that that's a good place to stop for so-called depth-oriented therapy. Let me talk about my buddy Ed, Dr. Ed Perrin. Dr. Ed Perrin, one of my favorite Twitter doctors, therapists. This is just a quick little break to talk about something kind of fun for a sec. Let me post this. Okay, so our buddy Ed said, 3 days ago? He said, somewhere a therapist you never met knows about you. And I expanded this 2 days ago and said, somewhere a therapist you never met has rendered an opinion about you, which they usually should not do. So, dear consumers of therapy, dear patients and clients, if you're talking to that professional counselor, pastoral counselor, psychiatrist, psychologist, whatever, and you're telling them about your boyfriend, your girlfriend, your husband, your wife, your boss, whatever it is, 9 times out of 10, if your clinician is rendering an opinion, if they're giving you an opinion like your bestie does about that person, that's a problem. Now, we're all human. Professionals are humans, right? So we're human beings. We fail. We're flawed. Excuse me. So it's not unusual for this to happen. However, it's a problem. So let me plant a flag on behalf of the profession, which is I generally advise all therapists to never render an opinion about a person who is not in the room. No, he doesn't have ED. Ed's great. So Phil's like, does he have ED? No. Ed's great. So let me say this again in the clearest possible terms. Dear professionals, please never do this. Dear patients, if your therapist does this, this is a problem. It's not a catastrophic problem, but it's a problem of bias. So, therapists should never opine about people that are not in the room. And it's for two very simple reasons. First and foremost, when a patient is telling you about their significant other, their spouse, their boyfriend, girlfriend, whatever, if a patient is telling you about their boss, if a patient is telling you about their friend or their family member, we always have to remember that the person sitting across from us in therapy is very biased themselves, is engaging in defenses, is ignorant, all this stuff. So when a patient comes into therapy and says, I can't stand my wife because blank, I can't stand my boss because blank, I can't stand my boyfriend because blank, whatever the reason. If you're an ethical therapist, you should always be listening with a skeptical lens. What are all the patient's motivations for talking about this person? What are all the patient's motivations for talking in this way about the person? And most importantly, what does the patient not know about this person's circumstances and why they bother them? So those are just three easy examples. There's dozens more things to say. If you were in supervision with me, we could talk for an hour about it. But really, the truth is, for that reason alone, you should never, as a professional, your therapist should never render an opinion about some person you're talking about in therapy. But here's the other reason that's not as important, but still important. The other reason it's a bad idea for professionals to render an opinion about, a patient's spouse, a patient's friend, a patient's family member, is because you, the professional, have your own baggage or bias about that category of person. Every therapist, every psychologist, excuse me, every professional has their own bias and baggage around parents, spouses, and significant others, friends, family members, bosses, coworkers. Every therapist, every psychiatrist, every clinical psychologist, every coach, every guru, every Dr. Phil, every Jordan Peterson, whatever, every human being, every professional is a human, regular person. All of us have our biases because of our own stuff, whatever we've been through, that colors the way we see that category of person. And so unless you're a superhuman who's super Buddhist or something, who's like super non-judgmental and non-attached, you probably should not be rendering an opinion about this person you never met because you have your own bias about this person you're probably not aware of in the moment. So in the spirit of not screwing up your patient and not giving an opinion that's not necessary or a highly biased opinion, maybe don't say anything. Maybe explore and be curious. Maybe the patient needs encouragement. Maybe the patient needs perspective. Who knows? But they don't need your opinion about their spouse. Right? They really don't. So, dear Ed, thank you so much. Dr. Perrin, thank you so much. Please do not render opinions about your patient's family members and friends and spouses and bosses, because it often comes from you about your experiences. It doesn't come from a perfectly unbiased and neutral place. It comes from your countertransference and your bias. So, just for what it's worth, just a quick detour, palate cleanser. Thank you, Ed, for the grist for the mill. There's probably much more to say, but I think that's a really good start. So, dear patients, dear consumers of therapy, your therapist should really not be rendering an opinion about someone who's not in the room. All right. So let's get on to one of the bigger topics, and I don't know how far we'll get together today. It depends upon what the chat looks like and how caffeinated I am. So the other topic for today's podcast, which I think is important and is complicated. So I want to say this up front, that this is very complicated, and I don't believe that the pithy saying that people often say is actually true, but it's complicated. So let me come back to the specific thing that I want to refer to. So on December 6th, about a week ago, Jonathan Shedler, and let me repost this so everyone knows. Okay. So I like Jonathan. Jonathan Shedler's one of my favorite therapy follows because he just talks about really important, relevant things. Clogged nose. Sorry. I wish it was Coke. Anyways, common to hear therapists say, this is December 6th, Jonathan said, it's common to hear therapists say, the client is the expert on their own life. Then he said, I don't love this saying because it implicitly denies unconscious mental life. Point number one. The truth is, none of us fully know our hearts and minds. There's always more than meets the eye. Point number two. We go to psychotherapy because what we don't know about ourselves causes limitations or pain. We're actually not experts on our own lives. Through psychotherapy, we can become more expert. If the intent of this saying is to remind therapists of the need for humility about what we can and cannot know, then I would say it far more modestly as the statement about the therapist, not the client. And here's the quote. We cannot know anyone else's inner experience. It reminds therapists that they are not the expert of the patient's life without the denial inherent in asserting the patient therefore is. So, Jonathan, as always, makes a number of good points, and I want to walk them out for people because I think a lot of people that go to therapy will hear their therapist say some bullshit like this, and it's garbage, you know? It's a platitude to make everyone feel good about themselves, I think. So let's talk about it. So quote number one. The client is the expert on their own life. So therapists say this, podcasters say this, psychiatrists say this, coaches say this, gurus say this. A lot of people say this. And people will be saying it with, varying degrees of sincerity, because some people say this as just a way to pacify people or calm them down. Some people say it with 100% sincerity, where it's like, I just don't know anything about you. You're just a mystery, you know? And they're trying to be open and receptive or something typically pro-social like that. And fair enough. So then Jonathan said, I don't love this saying because it implicitly denies unconscious mental life. So I already talked about this on today's podcast. However, to reiterate what was said earlier, all human beings have defense mechanisms. We all have defenses like humor and denial and suppression and rationalization and intellectualizing and all these things. All of these defense mechanisms serve some ordinary purposes and they also serve some extraordinary purposes. So in ordinary everyday life, if something acutely bad happens, like we get in a car accident, we might make a joke about it because we're overwhelmed. That's ordinary. Humor is a defense against stress that we don't want to tolerate right now. It's a short-term defense. However, sometimes we do things like rationalize our bad behavior, our behavior that's bad for us. So people rationalize a decision to stay with a very toxic romantic partner because it serves some psychodynamic need or some childhood thing. And they have conscious excuses like, I think this person can change or whatever it is. And so that happens all the time. Those kinds of things, both short-term and acute and chronic, happen all the time. So no human being, as Jonathan said, is perfectly aware of all of their wishes and of all of their motivations. Because we have to have some degree of ordinary defensiveness, if you want to call it that, to be psychologically stable. Because if I want you to all imagine the thought process, do this thought experiment with me. Imagine every nasty thing you feel. Imagine every antisocial wish that you've had, like Maybe at some point in your life you hated somebody and you wanted them to die. Or maybe at some point you really lusted after somebody and you wanted to have sex with them, right? Like, just to pick the two easiest examples. If you broadcast that to yourself all day, you would judge yourself and you would feel psychologically guilty, ashamed, whatever it is. So your brain naturally does things to counterbalance or ward off, to use a psychoanalytic phrase, those, untenable feelings and thoughts and urges. So you don't, feel bad all day, right? And so all human beings literally do things to be unaware of their unconscious needs and wishes and injuries and all this stuff. None of us fully understand ourselves. For instance, on the more ordinary side of things, most people don't really understand how extroverted they are. Most people don't understand their personality organization. And so all of that, I think, is ordinary because most people don't do some in-depth personality testing or whatever. So there's a lot of ways in which humans are very ignorant about themselves. And so for that and dozens more reasons, dear patient, dear family member, you are not the expert on your life. The only thing you're an expert about is what you think about yourself. Jonathan says, I heard this phrase in grad school as well. I think the truth is it's aimed towards is that it's the active co-participation on the part of the client is a precondition for success in the change process. Absolutely. Right. It would be impossible, literally impossible to do good therapy without people being equal participants. Darren says, I reckon this technology lark will never catch on. What do you mean, technology lark, Darren? What do you mean by that? Just share whenever you get a chance. But yeah, it's impossible for anyone to perfectly understand themselves, let alone even mostly understand themselves. So what we do, as Jonathan said in therapy, is to, learn to become more expert. That's what he said in his post. And how you do that is through talking. You talk to people. And you learn things about yourself by seeing how you react to people, right? Megan Shea, first time chatter, glad you're here. Client, tell me dreams. So what does this mean? Me, I have no idea, but you do. Points directly at the client, light bulbs. Yeah, it's like they have some idea of what the meaning is. Now, the cool thing about dreams, at least, is dreams are often metaphorically or symbolically about real life things. And so you can kind of explore together and come up with hypotheses together. Jonathan says, the intent when some therapists say it is to invite the patient to actively join in co-creation of change. Absolutely. There's probably a more truthful way to say it, which is what Jonathan said. I think Jonathan's statement was, we cannot know anyone else's inner experience. And so that's true. So dear consumers of therapy, your therapist, your psychologist, your psychiatrist, your MFT, whatever, is not some brilliant mind reader, even if they act like it. So your clinical professional might be very insightful and they might pick up things about you and have insights that they can share with you, but that insight doesn't mean that they have some deep and profound understanding of your mind. Per our earlier conversation, depth only happens when two people are having some relatedness, when we're talking to each other, when we're sharing with each other. Depth doesn't happen alone in a room, so to speak. Depth is interactional, right? So I hope that makes sense to everyone. Now, Jonathan said, if the intent is to remind therapists of the need for humility about what we can and cannot know, then I would say it more modestly, right? So let's be clear. No one in the room, if you're in therapy, I want you to hear this super clearly. if you're in therapy right now, I don't care if your therapist is 85 and has been doing it for 50 years, or if they're 35 and been doing it for 5 years. Your therapist is not an expert in you. Your therapist is also not an expert in psychotherapy. To me, there's no such thing. Now, this might be controversial, so bear with me, but to me, there's no such thing as expertise in therapy. And the reason why is because I believe that good therapists are like good doctors. We are practicing medicine, and there's no way to be an expert in something that is always literally evolving. You can be an expert athlete, you can be an expert chess player, because there's a limited number of moves, and it's not like a super wild, ever-changing subjective experience. Chess is an objective experience. There's a winner and a loser. There are different colored squares and pieces and stuff. Therapy is wildly subjective, just like medicine is an always changing experience. So, genuinely speaking, because therapy is a practice, psychotherapy is a practice, it's something that we consistently get better at, right? If you have a really good therapist, their interest is not being an expert. Their interest is in progressively understanding more and more and more about you and about each other so that we can grow towards a shared clinical goal, right? And so there is no expertise in therapy. It is merely just, can we learn enough together and test some hypotheses together so that we can have an outcome that both of us agreed on at the beginning of therapy, or 6 months ago, or a month ago, or whatever it was. So expertise, in my opinion, doesn't even belong in the conversation around disorders, types of therapy. There is no expertise in ACT or CBT or DBT, in my opinion. You might be, a seasoned clinician in the sense you've been doing it for a long time, or you might have had a lot of experience and training doing one particular type of modality. And I guess in that limited case, maybe that might be cause for expertise. But the problem with that even is everything is so subjective and dynamic in good therapy that because it's always changing and because it's so subjective, you can't really perfectly apply all the principles rigidly in like the same way that you can play chess, so to speak, expertly in therapy. So I personally believe, and this is something I tell my interns, is that we should not be shooting for some kind of brilliance or profound insight or deep or expert or whatever. We should be shooting for effectively achieving the goals that were agreed upon at the beginning of therapy. And if a new goal has been created, achieving that goal. And so therapy is a practice. And for that reason, it doesn't matter how much you actually know about yourself as a patient. Because no matter what your problem is, if it's major depression, PTSD, personality disorder, substance use disorder, whatever it is, the goal really is to have a collaborative, ethical, professional relationship where both parties have some buy-in and some say and some knowledge that we share and we do hypothesis testing with. And we figure it out together. And that's it. And it's that simple. It's not easy, but it's that simple. And so you are not an expert in your life. And I am not an expert in your life. I'm not even an expert in clinical psychology. So that's what I think we should consider, is we shouldn't even think from the framing of expertise because it doesn't apply to this particular discipline. It's like being an expert painter. Who says who is an expert painter? That's such bullshit. Some people love Monet, some people love Monet, some people love Salvador Dali, and so on and so forth. And art is extremely subjective, just like therapy is. The only real practical question is, did you actually achieve your goal together? That's it. That's really what it comes down to. And so from that perspective, there's no way to be an expert at having relationships because none of us are, especially not therapists. And if you don't believe me, ask your therapist about their personal life. They shouldn't really tell you a whole lot, but most therapists that I've met here in Southern California don't have the best personal lives. Some do, but a lot don't. A lot are really fucked up. A lot are in codependent marriages. A lot have really screwed up friends, family of origin experiences, a lot of family cutoff, family enmeshment. So therapists are just regular people, just for whatever it's worth. So I really hope everyone understands that you are not the expert in your own life. And there's zero expectation for you to be, because it's an irrational thing to think. Because none of us, literally, none of us are experts in our own life, because all of us have defense mechanisms that keep us psychologically stable. Homeostasis for my buddy Jonathan. And so to achieve psychological homeostasis, we have to be somewhat in denial about our motives or needs or wishes, because being fully aware of all the things we think, feel, and want at all times would make us lose our minds. So I think that's enough for today. I think that's enough. So I really greatly appreciate all of you coming out today. It's been awesome having a lot of people in the chat today. A new person, Megan, glad you're here. Darren says, as Roger said, being genuine, being congruent, being rather than doing. Yeah, exactly. Yeah, our job is not to know things. Our job is to do, or be even, and being is an evolving experience. Excuse me. So very, very grateful for all of you being here today. It's been awesome having a lot of people in the chat. It's been awesome being able to talk about some really popular pop psyche things like you are the expert in your life or some shit like that. And being able to talk about it honestly. Same thing with depth psychology. There's nothing wrong with wanting to understand deeper things about yourself, but also people can avoid the here and now, by the way, by caring too much about the deep stuff of your childhood. Jonathan says we should have a homeostasis drinking game. Absolutely. 100%. Let's do it. So yeah, I think these are really good topics. And I really encourage anyone who's watching and listening, if you want, you can send me topics. I'm certainly happy to talk about things that I haven't talked about before, or I can say more about, or I can clarify, because I want to make this podcast very useful for anyone who watches and listens. So please don't hesitate to reach out to me, especially on Twitter. If you're on Twitter, my handle on Twitter is @Alobha Patrick, ALOBHA, which means non-attachment. Alobha Patrick on Twitter. Feel free to DM me, publicly tweet at me, etc., harass me, send me memes, whatever. And I'll talk about basically whatever if it relates to psychiatry, psychology, and mental health, for sure. So yeah, thank you all for being here. Thank you for making this awesome and fun and easy. It's always easy. This hour just flies right by when we're all chatting together. So thank you all for being here and sharing and contributing and adding useful perspectives. I feel like everyone who chats is trying their best to, show up and say something useful, interesting. I do this every Saturday. So the UnShrink Me podcast is every Saturday. And the goal of the UnShrink Me podcast, just to be clear for everyone, is not to shit on a particular person, is not to, destroy everyone's faith in psychology and psychiatry. The goal of this podcast every week is just to provide, hopefully, useful and or new perspectives on very popular or important topics in psychiatry, psychology, and mental health, so that patients and their loved ones can engage in services better. That's my hope. That's my genuine goal. I don't want people to be turned away from therapy unless you really don't need it. I don't want people to be skeptical or cynical in a way that's pessimistic. I want you to be skeptical consumers of an important service. That's all I want. I don't want you to have no faith in the profession. I have all sorts of faith. I'm still here. I'm still teaching. I'm still doing my job as a consultant in the industry. So if I genuinely believed it should die or something, I would say that. I'm not a very bashful person. I'm doing this podcast so everyone has a more critical, more well-rounded, more thoughtful, reasonable view on the services they're seeking out, on the people they're trusting with their lives. That's all I'm here to do. And I hope that I've achieved that here today. So please let me know if I've achieved that. Please criticize me publicly if I'm doing a good job or not, because I don't want this to be overly negative, and I don't want this to be like cheerleading the profession. I want this to be balanced. Fair and balanced, like Fox News or whatever. So that's my goal. And I appreciate you being here. If this was helpful, interesting, or even funny, please like, share, and subscribe. Please send it to your friends and family members who might be struggling with mental health, who need advice and feedback about how to find good services. If any of you are struggling or someone you know is struggling, feel free to reach out to me in my DMs on Twitter, and I will happily try to direct you towards someone in your area that might be able to help you. And without further delay, as always, I like to end every podcast on a joke. So let's see how this goes. Let's see how this goes. So, once upon a time, I once had this patient. He was a very successful guy, very kind of prominent person in society. And he was diagnosed just like a couple of months ago with schizophrenia. He had hallucinations, delusions, the whole thing. But because he was kind of older, my first thought was maybe he had dementia or something. I don't know. Anyways, so he started hearing voices a couple of months ago. And the voices were telling him, like, you're the greatest president that has ever lived, which is, interesting. And so you can probably guess that, he had delusions of grandeur. It's where you think grandiose things about yourself that aren't true. Anyway, so he came in for a session last week, and he was telling me that he got some new meds. And these new meds had cleared up his hallucinations because the voices were telling him, you're the greatest president ever that has ever lived. And he's like, you know what? I realized that I'm actually not the greatest president in history. In fact, I was never even president. I've never been president. So just so everyone knows, like when you work with people who are experiencing psychoses and stuff, you don't push them, let's say, or challenge their psychosis. You're not supposed to like challenge their delusions. When you work with people with psychosis, you're supposed to really just help them feel safe and explore the meaning of their hallucinations and delusions and learn to regulate and all the stuff. And hopefully their meds will help with at least the hallucinations. So anyways, this guy came into therapy, diagnosed with schizophrenia, maybe dementia. And he's like, listen, I've been on these meds and I now feel okay again. And I know that I am not the greatest president in history. And I've also never been president. I was like, oh, okay. Interesting. And I asked him, since I've never heard you say this before, this is a new thing. You're getting all this insight about, what's true and what's not true thanks to these meds. But why did you think you were president the whole time? That's strange. He said, well, yeah. Who did you think I was referring to when I said I was the greatest president that ever lived? I said, well, I thought you were probably just referring to yourself because you've had this big career. You've been very prominent and all this stuff. I said, I'm so sorry. I misunderstood. He said, yeah, it's been really hard to come to terms with the fact that I've never been president. And, the truth of the matter is, in full transparency, I've never been that guy. And I said, you know what, Mr. Biden, we all know that. All right. It's been good to see you all. I'll see you next week. And I hope you have a good weekend. Take good care of yourself. Have good food. Have good sex. Have good fun. And be good to each other. I'll talk to you soon. Goodbye.